Hi, welcome everyone. Thank you for being here. I appreciate you coming to this session of our Postbac Career Exploration Series. Today, we're going to be hearing from experts about the field of public health. So I'm really excited to hear from them as well. And Dr. Jackie Levine is going to be moderating our session. I just want to quickly ask a couple of logistical things. Each of you should see a Q&A box, and I would ask that you please put your questions into that Q&A box throughout. Jackie's going to be moderating using that box, and so she'll be looking there and not so much in the chat. So please put your questions in Q&A, and we will be using your questions as we go along. So do start to think of those and go ahead and put them in when you're ready. And we're going to hear from our panelists first, and then we'll get right to your questions. So with that, I'm going to hand it over to Jackie. Thank you, Jackie.
Great. Thank you, Laura. Welcome everyone to this session. Happy Friday to you all, and I congratulate you all on taking a little time for yourselves to do some career exploration, which is a really important part of your time as a postbac at the National Institutes of Health. I am, as Laura said, my name is Jackie Levine. I work at the National Cancer Institute, and I work in the Division of Cancer Epidemiology and Genetics, which is one part of the intramural program of the NCI. I oversee the fellowship program in that division. I came to the NIH as a postdoctoral fellow right after completing my PhD and MPH a long time ago now, and did my postdoc at the NCI prior to transitioning into a more training focused role. But enough about me. You're here to hear from our panelists today. So I'm going to hand it over to one of the panelists. And if each of you could hand it off after you're done, if each of you could introduce yourselves, take a few minutes to just say a little bit about yourselves that you'd like to share with the attendees today before we go into questions. So first, I'm going to call on Emmanuel.
Well, thank you, Jackie. It is truly a pleasure to be here. Just a few words about myself. So I was at the NIH for almost 10 years. So I was at different NIH institutes. I landed at NIH at NHGRI as a fellow. So I definitely understand where you guys are at in your career. I was almost at the NIH for, as I said, a decade, starting with helping launch H3 Africa. Global health has underpinned my career, and also teaching. Went to the Common Fund, where I helped in terms of global health for H3 Africa and the Medical Education Partnership Initiative, MEDP as it was called. Worked on global health at NICHD and also at NHLBI, or the Heart, Lung, Blood Institute, before eventually transitioning to academia. Overall, my initial plan was to be at the NIH for about 5 years before going to academia. I ended up being there for about 10 years because, I enjoyed the work that I was doing at the NIH. But after a while, I had to really think about where I wanted my career to be. And I wanted to be in the global health space. So after 10 years, I felt that it was time to make that leap of faith and move to academia. Now I am at NYU. I started a lab around 2019, and I mentor over 20 students. I have an MPH student that I mentor, a DRPH student. I have a great group, and we're doing a lot of great things in sickle cell disease, HIV/AIDS, and maternal health and obstetric hemorrhage, and the interface of both implementation research and global public health. So overall, my career spans both government service and now academic research. So I have had more of the non-traditional career path, and I'm happy to talk to you about that. So I will hand it off to either Kellan or Sudha, whoever wants to sort of chime in at this point.
Sudha, looks like you're ready to go, so let's have you go next.
Were you calling on me, Jackie?
Yes, yeah, sorry.
All right, all right. Thank you to both Laura and Jackie, and another note of welcome to the audience. My name is Sudha Shivaram. I'm at the National Cancer Institute, and in this institute, I sit at the Center for Global Health, and I oversee a portfolio of global cancer research training. So this includes planning research training programs that US and foreign institutions can apply to develop capacity for global cancer research training, as well as working with colleagues such as Jackie and others across the National Cancer Institute to provide programming for our intramural fellows who are interested in global cancer research. I came to the NIH sort of in reverse order of what Emmanuel was saying. I came to the United States as an undergraduate student with an interest in immunology and did some work in a lab setting I remember it was interferon A and its antiviral properties. But somehow as I was doing my training, and research, I came across several epidemiologists who were doing global public health work and was really fascinated by that field. I had no exposure to that field of public health while I was training in India. I continued to pursue a master's in public health, and I got that from UCLA, and did a lot of work both with international agencies such as the World Bank and US-based international NGOs, both in the United States and in South Asia, particularly India and Nepal. Following that, I pursued a PhD, I should clarify, I pursued a doctoral degree. So I got my DRPH at Johns Hopkins in the School of Public Health. I specialized in epidemiology and a focus on international health, of course, and I served as faculty there for about 11 years before I came to the NCI. So I'm happy to answer any questions about a career trajectory similar to mine, and any other questions you may have.
We've already got lots of concepts coming here, DRPH, academia, NIH. Let's hear a little bit of a different perspective from you, Kellan.
Sure, thank you, Jackie. I have a very straightforward story to tell you all, which as I get into it, you will see not straightforward at all, which is something that I hope is helpful for folks to hear. I know that can feel like there's only one way to go about getting to where you want to go, but I am living proof that there are many ways to get there. I'm currently the executive director of the Whitman-Walker Institute. It is the research, education, and policy arm of the Whitman-Walker Clinic, which is a federally qualified community health center in Washington, D.C., that has over 40 years of experience serving primarily LGBTQ people and people living with HIV. I came to this position from Johns Hopkins. I completed a PhD in health services research and policy earlier this year, but I am older than I look. Thank you all for, I'm saying I look so young. But before that, I was working in DC in the field of health policy. And so the way that I came to that is my undergraduate major was astrophysics and Russian literature. Really makes a lot of sense to combine those things. I was working really hard, honestly. I'm transgender, and I was working really hard at dealing with a lot of the things that life was throwing at me, and the way that I dealt with that was by burying myself in academics and two hard majors. And after I graduated, I moved to Moscow, where I worked as a translator for the Russian Institute of Russian Academy of Sciences. And that's actually where I transitioned, was in Russia. And I started looking while I was over there for ways to be more involved in a career that had direct connection with people. I was working for Special Olympics part-time as well, and wanted to do more to understand what are the ways in which laws, norms, policies, societal expectations constrain opportunities for some people and offer opportunities for others. And the ways in which those things are not shared equally. So I came back to the States in 2008 to do an MPH and a master's in international development at George Washington University. and then got swept up in the excitement of the election of President Obama in 2008, started working in health reform, and so participated in the drafting, passage, and implementation of the Affordable Care Act, primarily as first staff and then a senior fellow at the Center for American Progress. So as I say, very straightforward. There's been lots of twists and turns along the way, and I'm happy to talk about any and all of them and look forward to your questions. Thanks for having me.
Thank you all so much for sharing your stories. It was really, really helpful to think. And I came from a language background too, so if not, some similarities there too. I was a French major and worked abroad before coming to biology and epidemiology. And remember everyone to, as I'm sure you've heard some things that you want to ask about, feel free to pop your questions in. As Laura said, feel free to use the Q&A to do that. That's helpful. I see our first question, though, came in through the chat. So let me call that one out here. Someone's asking about the intersection of genetic counseling with public health. Does anybody have an insight on the types of jobs that connect the two?
In terms of specific jobs, I think others may be better positioned than I to speak to that. But I will say I have been on an advisory group for NHGRI, the National Human Genome Research Institute, for the last 5 or 6 years. And we're in the process now of launching a project group that actually looks at LGBTQI plus issues in genomic medicine and genetic counseling. And some of the things that come up there really relate to public health, because we're talking about disparities affecting LGBT populations and the places that they come from, right? These things are not rooted in the genome. They're rooted in the circumstances that people are encountering when they're trying to go to work, go to school, get healthcare, et cetera, become parents. And so from the perspective of genetic counseling, there's a lot of issues that we're seeing coming up around, again, issues of access to different kinds of services, ways in which people understand who LGBT populations are, broader questions about the relationship between the genome and its role in health and the environment and its role in health. And so many of you may be familiar with that, the sort of breakdown where we look at the percentages of health or well-being that come from the doctor's office versus genetics versus the environment, and the very large role that the environment plays in structuring people's health and well-being. So there is a huge amount of work that needs to be done there at the intersection of genetic counseling and public health. And I would invite, if my fellow panelists have ideas on specific jobs.
So, Kellan, I agree 100% with you and the comments you've made. So, number one, in terms of the strategic visioning that NHGRI has basically launched and what they put out, they talked a lot about implementation research and genomic medicine, and I agree with you. I think that genetic counseling and public health really need to be moved forward, and they need to actually incorporate implementation research, and I think that's really what is missing. So when I was at NHGRI, they talked a lot about genetic counseling and moving sort of more toward genomic medicine, and that still needs to be realized, right? There's still a lot of work that needs to be done, and I think NHGRI needs to move towards that end. So I believe that if individuals are thinking about a career in that path, on that path, there is room for that. The interesting thing is that it's going to be one of those ways that you have to be creative, right? So it's going to be one of those things that you're not going to see a job description that's going to say, hey, we need somebody that has some of these things. It's going to be one of those things that you're going to sort of have to start in one way, and you're going to have to sort of create those positions and say, hey, I'm kind of interested in this. Is there an opportunity to work in these areas? And then you're going to have to sort of maneuver and move into those particular areas. And that is the way in which you sort of get into those ways in terms of having that intersectionality of public health and genomics. There is a journal called that has been produced. I think that's called Public Health Genomics. That exists. I think I published a paper in there several years ago. But they're still hard on the genomics side and less on the public health side. And I think we need to more focus on the public health aspects of it. So I do agree there is space for more public health in genomics. There isn't that area as of yet. So there are opportunities there.
Jackie, can I say something quickly? I know there will be likely more questions, but this is particularly given the advanced tools for genetic analysis that are available. There is a big gap between what can be done and what the public knows, or even sometimes doctors know that can be done with those tools. For example, in cancer, popular sites such as 23andMe, they offer a lot of tests that can evaluate your risk for cancer, but they are not by any means comprehensive in terms of making a risk assessment. So there is a lot of intersection between genomics and public health, particularly amongst populations that experience disparities in the United States, where there is need for both education and an understanding of what these genomic tools can offer, both at the community level and at the primary care level.
Great, thank you, Sudha. And I'll add also, in the group that I work with, we have genetic counselors. If it's someone who's interested in doing research related to genetic counseling, we have folks that work really closely with our large families that have a genetic risk for a variety of diseases that then potentially predispose them to cancer. And our counselors work with those families in the NIH Clinical Center, doing research alongside our folks doing familial genetics and trying to understand the underlying causes for cancer. So just adding that in. There's another question that I'm sure that's on the mind of many postbacs, really thinking about getting a master of public health someday, and like what's the day-to-day work like for someone who has an MPH. This person is working in the laboratory still and noted that it's a little bit of a lonely thing to do. And in fact, this is one of the reasons that I ended up getting an MPH and wanting to make work more applied. And this person in particular really wants to ultimately work with other people and not so much working, it sounds like, manipulating things in the laboratory. Who wants to start with that one?
So I'll be happy to take that question on. So in my lab, the IC lab, we don't do pipetting, right? So we're a dry lab, as you call it. We do data analysis, systematic reviews, a whole lot of other interesting things. Because of the nature of what we do, and I'm in the School of Global Public Health, all the things we do are communal in terms of just the way we have our structure set up. I mentor like 15 or 20 MPH students. Our degree program is 2 years at NYU. I also mentor a DRPH student. I have a PhD student. She'll be finishing up next year. And the DRPH student will be finishing up in like 3 or 4 years or so. So I think that in terms of public health, in terms of what you do, it's varied depending on what you want to do. One of my graduates from our program in my lab actually works at NIH in a different capacity. She doesn't work in a lab. So the jobs for MPH are varied and wide. There are some that work for USAID, so it's quite extensive. It can vary as much as you want it to be. And it gives you a whole broad training in epidemiology, different aspects of public health. And I guess, Jackie, since you have an MPH, you can talk more about it. But again, I guess it's a degree that gives you as much latitude in terms of what you want to do as you want, and you gives you the ability to do what you want to do in terms of the public health endeavor. So I guess that's an answer that's kind of broad and open-ended in some ways. So
Maybe I'll pop down to Kellan, actually, since you, I know, got a Master of Public Health not that long ago.
I did the MPH in 2008. That was part of that career shift from when I realized that nobody wanted to hear my really important thoughts about Dostoevsky or whatever. And so the Russian was out. And to the question, didn't want to be living in a basement lab analyzing data from telescopes all day, really wanting to be in touch with people. And so I chose the field of public health because, this sounds like not a nice way to describe it, but I mean it in a really positive way. It's a real grab bag. You can do anything in public health because everything affects people's health and well-being, right? The social, political, economic determinants of health are all around us. And so anything can be within the ambit of public health. It's not just quarantines, it's not just infectious disease, it's not just any one thing. It is about all of the circumstances and environments in which people, families, communities, populations are embedded. And so the MPH for me was a very good experience. I went, as I mentioned, to GW, George Washington in DC. I came for the program knowing nothing about the city and ended up loving the city and really actually taking a lot of opportunities during my MPH to be involved in policy work. So when I started as a policy analyst at the National Coalition for LGBT Health in early 2009, I was a full-time MPH student. And so GW, and there are a number of MPH programs that are like this, had a lot of classes in the evenings. So I was able to work during the day and then go and sort of have a really nice connection between the work that I was doing, learning how to do policy in DC, and the more theoretical side of learning the language of public health. It really is a language. That was probably the most useful thing for me about the MPH program, was learning the language of how to think about public health concepts coming from, I had a more sort of medicine-oriented sort of mindset for a long time. And so moving into public health and learning that language was really important and useful for me. So it was a great experience. I would recommend the MPH to folks who have a whole variety of interests, because you really can do just about anything with it. You can do research, you can do policy, you can do programs, you can be involved in your communities in all kinds of different ways.
I'm going to jump to kind of a combination question that, there are postbacs that are working at the NIH, and some of them are interested in going on to do an MPH. And is there anything that they could do now while they're still a postbac to get more involved in public health, learn more about public health in preparation, and then, kind of moving that question into some spaces that are being mentioned, like the effects of climate change on public health, and how can, kind of the intersection of all that, going from where they are to doing that kind of career, and in particular, maybe in places like related to policy, not-for-profit organizations and things like that. I know that's kind of a complicated questions, but, combination of questions, but what commentaries or helpful ideas do you have? Maybe with you, Sudha, we could start.
Okay, sure. I think what helped me, and I think this is sound advice even today, is to sort of talk to individuals who are working in the field. And NIH has this wonderful resource called NIH Reporter, which is basically a database of all funded grants at the NIH. And you could search by university, you could search by different terms like disease outcomes, whatever. But sort of understanding what people are doing, what kind of research projects are ongoing. And I would even begin, if, given that we're all in the DC area, to, to look at the GW website, for instance, UMD and Hopkins, and see the type of research that's going on, because I know for sure at Hopkins there's a lot of involved work in planetary health, as they're calling it now, at the the intersection of climate change and public health. So kind of understanding, because there is what you read and what you will study in courses, and and there is another way where researchers apply that. Certainly, a lot of NGOs in the DC area who are doing some fantastic work. So I would say begin there, trying to understand and getting informed, interacting with the experts. And I found that people do remember. So when you turn in your application, I remember writing a note to the professors, and I had spoken with and saying that, listen, I really like your program. I'm writing to, I've applied to the program. I'm not saying that influenced the decision in any way, but certainly that those interactions were very helpful, particularly because I moved from bench work, sort of wet lab work, into more public health.
Any other thoughts on those topics from our other panelists? Go ahead, Kellan.
Yeah, with regard to the specific question of climate change, I would really encourage folks to look at what the Biden administration has put out around climate change. There's now an Office of Climate Change that is looking at equity issues, which really, when you're talking about equity, it surfaces, it has aspects across all different kinds of domains, but health is a really core piece of how we think about equity, and I think how to work towards achieving it. Because as we were talking about earlier, my favorite refrain, the social, political, economic determinants of health, like all of the things that are happening, inequities, injustices across all these different areas of life, and including aspects of environmental justice, environmental racism, and the impacts of climate change, all of that comes back. You can really see its effects in people's health. And so looking at some of the language, I think, coming out of this administration, as they're really trying to talk about equity, really trying to foreground that in a lot of the policy work that's happening, I think that's a really good way both to be more exposed to different ways of thinking about public health. A lot of the folks who are working on these efforts have MPHs. Actually, PhDs don't often end up in government or sort of end up on the front lines of doing that kind of work, just because of the way that the PhD encourages us to really specialize and really encourages us to really try to focus in on research. So if you have an MPH working, for example, at the local or state or national government level, doing work related to climate change or doing work related to any number of issues is definitely within the purview of an MPH. So I would really, as I say, go and take a look at some of the things this administration is putting out, both for those ideas about what public health equity looks like, and for some ideas on how to maybe think about incorporating policy work, or at least perspectives in your own work and your own planning. Policy is one of those words that I think many of us find hard to figure out exactly what that means. But policy, it's really just how we get stuff done. It's really just how we do things. And it can operate at a government level. It can be in private organizations. It's essentially just how do we move the levers in order to get the effect, the change that we and our communities need. And so really thinking about getting involved in policy is something I would really recommend to all of you.
I think this is all really great advice in terms of thinking about, where we're going, right, in the field of public health and what opportunities lie there. And I think you've both given really great advice. And then thinking about, looking at a school of public health's website, see what kinds of degrees are offered. And I'll add in, if you meet people or, as you're doing your research who are potentially doing the kind of job that's really cool sounding to you, see if you can get a little bit of time to talk to them about how they got where they are, and then what kinds of training you need to get there. Which brings me to the next question of that I'm seeing in terms of, we've talked about an MPH and you've all shared your training, and I know, Emmanuel, your I don't think you have an MPH, but you're doing public health work. So thinking about like, do I need an MPH? Do I need a PhD? What is it that I need to do this kind of work? So, and I know you also mentioned that you're mentoring folks with an MPH and a DRPH. So maybe talking a little bit about like that degree and how to do work in public health. What kinds of degrees do we think we need?
Sure, I'll be happy to start. I think that you need the core classes. I don't have an MPH. I have a PhD. I think having an MPH is a great thing to have. So at NYU, you have the option of getting a PhD or a DRPH. We just started our DRPH. So what you need is the training in those specific public health coursework. And for the PhD, you need also that scientific training in terms of doing that specific sort of coursework. So I think that what is most important is that you obtain that particular training and coursework. And there are several ways to obtain that training. So to me, I think that focusing on degrees is only important if you get that particular set of training and that set of skills. And for me, those set of skills can be obtained in a whole host of different ways in different environments. And that's the thing that I do. So as I state, in my lab, we do mentor individuals, and I do take mentorship very, very serious. And I do make sure that individuals have those set of skills when they leave in those particular domains in terms of core competencies. And we are a school of public health, so we have to have those accreditations because we're an accredited school, and we have to make sure that we adhere to those particular CEF accreditations, CEF requirements in order to award those particular degrees. And of course, I teach courses in public health, etc. So we meet those particular requirements, etc. So, and then I will turn it over to any other individuals that want to expand in terms of just thinking about degree requirements and etc.
If we could have Sudha go next, actually, I'd like to hear your thoughts on that, and also maybe commenting a little bit on how the DRPH, how that's different and what's special about it, and what, in terms of how that degree is very unique. Oh, you're muted.
Okay, sorry about
There
that.
you
Yeah. Yeah, so I did the MPH first, primarily for reasons that Kellan mentioned, because I sort of wanted to understand broadly the field of public health. And, the core courses you do in MPH are typically, epidemiology, biostats, environmental health sciences, health behavior, health systems. So really, I completely agree with Kellan that it's a broad degree that helps you get started in the field. I would, however, say that if you're really interested in an academic career or in a primarily research career, a PhD might help, only because it gives you a little bit more focused skills on specific research areas. And that is my experience, because as I was doing the MPH, I thought, I want to do global health, and I want to be doing research in, applied epidemiology in global health. And for that, there were certain set of skills that were needed. And I did not pursue them at the MPH because I was very much, my MPH was focused more on population health, health policy. And as I began working in the field after graduation, I realized that, I really want to be in a research career. So I think, that's a distinction. I would say that if you want to be in an academic research career, you may consider a a doctorate degree. I chose the DRPH, as I mentioned, it was a relatively new program at Hopkins then, and because it was pitched as something that is more applied. I mean, having worked in the field for some years now, I think I mean, I don't know that there is a lot of difference between a DRPH and PhD. If I, the DRPH, I remember, was awarded by the School of Public Health there, whereas the PhD, it's a Johns Hopkins degree. I mean, Johns Hopkins University degree. I mean, there were some small differences, but really in terms of coursework, in terms of our ability to select whoever we want in our advising committee, any topic that we want for research, I don't think I saw a lot of difference. My degree was several years ago, so I don't know how these programs have evolved now, but I do know that there were colleagues, even recently, who were pursuing the DRPH, who are able to either pursue an academic career or more of a policy career. But I think I really would echo what Jackie said, is, talking to people who are running those programs, who are working in those degrees, with those degrees. And, ultimately, it depends really on the opportunities that you get as soon as you graduate, and how you navigate, the career from that point forward. These are just my impressions.
Thank you. And Kellan, maybe you could comment on this, and maybe comment also on your thoughts on the range of possibilities for careers with a public health degree.
Yeah, with regard to the DRPH and the PhD at Hopkins, I did my PhD at Hopkins, and we're in the same department. Things are you essentially at this point can't tell the difference in a lot of ways. Well, the DRPH was, as Sudha mentioned, intended to be more for practitioners, people who wanted to be, for example, in management, as opposed to folks who wanted to be more purely in research work. But essentially, at this point, people move back and forth. It's similar, I think, in some ways to the doctor of medicine versus the doctor of osteopathy. They're different, but just basically in name only in a lot of ways. I think one thing that I want to say just quickly is that you don't need a PhD, a DRPH, an MPH, or any of those other degrees to do your best work. These degrees are useful because they open doors. We are in an environment in our society where people want to see these credentials. And for many of us who are coming from backgrounds where we may have felt like we need to work especially hard to prove ourselves, these degrees can seem like a real necessity. And often they do really open doors, and they do help you learn that language, as we were talking about earlier in, for example, public health, but you don't need them to do your best work. And I think one of the things that I would say for those who are going on to these types of degrees is really to not allow them to take you away from the communities and the work that you want to do. All of these programs train and shape people in specific ways. And if you're going into a research program, it will do its darndest to make a researcher out of you. If you're going into a medical school, it will do its darndest to make a doctor out of you. And that's good, that's its purpose. But also it can sometimes be really easy to lose track or lose sight of the broader perspectives of what is the work that you want to be doing? What is the way that you feel like you can make an impact? And what are the ways in which all of us, I think, in all of our professions need to be more aware of that context in which we're living and working and doing our research or doing whatever other type of work we're engaged in. I would really love, for example, to see all MDs required to take more classes on population health, public health, right? Because of the ways in which it just permeates everything around us. If you're a researcher, it affects your research subjects. If you're in government, it affects the people that you're serving as a public official, and so on and so forth. So I would just encourage everyone. I know these degrees can really sound like the be all end all and something you have to do. And for many of us, I mean, I have 3 graduate degrees. I clearly have a problem. But I learned something from all of them, and I'm glad I did them, and I was fortunate to have the opportunity to do them. Master's degrees are not cheap. This is a major problem. PhDs, DRPHs, often there is funding available from schools, from places like NIH, but master's degrees tend to be self-funded, which is a problem. And so I don't know, and I don't know if my fellow panelists have any thoughts on this. I don't know of any good hacks about how to get funding for something like an MPH. I was fortunate to have some family support, and I also worked all the way through it, which may or may not be resources that others have access to. So just to answer, now that I've gone off on all of the tangents, to answer the question about what kind of work you can do with an MPH, you can do, as I say, you can do research. I know many people with MPHs who are doing research. We have folks here. The Whitman-Walker Institute has a substantial research program, NIH-funded research program. We have MPHs who are doing data analysis, who are doing study design, who are executing the research protocols, so meeting with research participants, doing measurements, doing write-ups, writing papers. We have folks who work in the government. A lot of people in, for example, your local Department of Health, State Department of Health, will be MPHs. By and large, the leadership often tends to be the MDs, but the folks who are actually doing the work often tend to be the MPHs. So the folks sort of on the front lines of trying to talk through how do we deal with COVID, how do we do urban planning so that people can actually get out and move in their local communities. All that kind of work is done by people with MPHs, both in the government and then in a variety of nonprofit organizations. There's a huge universe of nonprofit organizations that do work that is either explicitly public health or really is part of that sort of social determinants piece of urban planning or nutrition or exercise or any number of different fields. So you really can do just about anything in the field of public health with all kinds of organizations.
So I have a quick comment, and this is to piggyback on Kellan's exceptional comment in terms of hacking the MPH. So Kellan made the point about cost, and his point was, my calculation was exactly what I thought about. So it would take 2 years to get an MPH at, let's say, 50,000, or it would take an additional 3 years to get an PhD. So 2 years, 50,000, or I could do 5 years and get a PhD. And the PhD was a higher degree, a terminal degree. This is what I thought when I was actually at this point when I had my bachelor's. So I said 2 years and I have to be out 50, 60,000 at that point, or 5 years, and I could basically get that degree for almost free. So I decided I'm going for the PhD. So that's what I decided. And if I needed to get a master's, I could get a job, and then my job could pay for it. And that's that was my main calculus in getting the PhD, to be honest with you. So it was pure economics at that point, because after I got my bachelor's degree, I actually had worked for 2 years, and I had noticed that my job would actually pay for me to get my master's degree. But if I went straight and got my PhD, I noticed that the federal government had sort of incentives and everything else like that, because I had done my research. So that was my calculation. So I started applying for graduate school and checked the box for the PhD program. And I got admitted into a couple of PhD programs. I got a lot of rejections, but I only got admitted to a couple, and that's what I needed. And that's what I went to. So again, simple answer. And then in terms of just the DRPH versus the PhD program, both Kellan and Sudha are correct. For some schools, there is not a difference. For NYU, I sit on the DRPH admissions committee, and we just started our DRPH program. And we have intentionally made it different from our DRPH program. And in fact, we require that you have to work in the field of public health for at least a minimum of 2 years, because we are looking for leadership. Our DRPH program is specifically training for individuals that are working in the field who wants to advance their careers and are looking forward to training individuals that are going to be in leadership careers. So we are not going to be doing sort of the leadership, sort of making it interchangeably with a PhD program. We're making it very not open-ended, very specific, and we're tweaking it so that we're making it sure that it has the caveats of a DRPH program that's geared toward leadership. So we're distinguishing our specifically from the DRPH program. So I have a PhD student that has a certain set of needs and a DRPH program, a student that has a certain set of needs. So that's the way we have conceptualized it. And as a committee, we've really thought through this and in terms of how we're executing it. Not every school has this. I think some schools look at those two programs as interchangeable, but at the School of Global Health for NYU, we have taken a different approach in terms of these two programs. So.
Jackie, can I just say something really quickly to the question of the degrees? In case this is useful as an illustration, so I have a PhD, I run a research and policy organization within a larger health system. So the outgoing CEO of that health system has an MPH. He was in healthcare consulting. He worked with large hospital organizations and insurance plans on making them financially sustainable before he came to run the Whitman-Walker Clinic, which was then a nonprofit, not federally qualified community health center that was really struggling to stay open. So as an MPH, he came and took on the role of the CEO of the clinic, has grown it, and is now leaving. And my new supervisor, my new boss, the head of the health system, will be someone with a DRPH. So he worked in large hospital systems in Maryland. He was the head of community health partnerships, so doing outreach between the hospitals and community-based organizations to support people coming in and out of the hospital, and sort of in that public health role. And so he has a DRPH, and he will be coming in to be the manager-in-chief, while I do more of the direct supervision of the research and policy work as a PhD, in case that's useful.
Thank you. There's a question. So one comment on Emmanuel's answer. I was just talking about that exact hack with someone the other day, in terms of a couple of years and paying for your degree versus doing a whole PhD and taking a little bit longer, but not having to pay for it. So nice job. I'm going to say you were the inventor. I wanted to also mention that there's a website, it used to exist, I haven't looked for a little while, but called Fund My MPH that may give you some ideas, I don't know, on things you could do, places you could find funding. And also someone asked about deciding between the different MPH programs, and it is very true that different MPH programs have different kind of flavors to them. And so I really recommend exploring different schools and the kinds of things that their graduates do after their MPH. What kind of student are they looking for, and what kinds of things do those students do afterwards? I'm going to jump to a question about mentoring. And does anyone have any suggestions or comments in terms of like finding mentors for a person who's maybe interested in going into public health? Someone who would be just at the postbac level now and hasn't, gotten a public health degree.
Yeah, I mean, I can begin the conversation there, Jackie. So, our office gets a lot of requests from postbacs who are interested in global cancer research. And what we do is, between colleagues and I, there is a certain set of experiences, and we offer, our kind of career trajectories as examples. We are also able to connect folks to individuals within the NIH who are interested in this topic, as well as folks professors and other faculty and experts in US academia as well as in international institutions, just to set up informational interviews and have similar conversations about, what, how did you get here? What is, just to understand what work looks like with a particular focus on global health. So we are always happy to make those connections and just welcome anybody to contact us.
I don't want to take too much time away from Emmanuel, who I know is a mentor extraordinaire. The thing that I would add is generally people like talking about themselves. Case in point, right? Like we're all here because we like to talk about the work that we do. A lot of people who are in different positions, I mean, obviously time, energy, all those things, scheduling factors into it. But in general, people, especially in fields like public health that are so people oriented, you can really get quite far with looking up people whose work you admire and just sending them an email. You may not hear back from them. It's nothing personal, but you might just strike up a relationship with somebody who's doing work in an area that you are really interested in. So don't underestimate just the sheer power of reaching out to people and inviting them to physical coffee, virtual coffee, whatever it is, and just saying, I would love to have 30 minutes of your time to hear about your trajectory, your career, how you came to be doing the work that you're doing, and if you have any guidance or suggestions for me. I just had that conversation with someone right before I got on this call. I was talking to a business development leader here in DC, and that was my exact conversation with her. I reached out to her and said, I'm new in this role at the Whitman-Walker Institute. I really want to grow it. I feel like I want to understand more about what sort of businesses, startups, what that world looks like, because we are kind of a startup here in the way we were, building our programs. And so I had half an hour with her just to say, I really admire the work you do. Can you please tell me a little bit about how you got there and what advice you would have for me? And the last thing I'll say is Stacey Abrams has a lovely book, Our Time Is Now, where she talks about building your own personal board of directors, reaching out to people, keeping people in your life from different parts of your life to help provide you with different perspectives and guidance. And so really, really prioritize relationships. You never know where people are going to go. You never know who knows whom. And you can have some really surprising and really wonderful connections if you initiate and grow and maintain relationships with people, not just in a professional mentor sense, but in all different areas of your life. So that personal board of directors.
I can't say anything more than Kellan has put it. I think that is so eloquent. So I can't say anything. So kudos, Kellan. Excellent.
Right, we just have a few minutes left and there's still a lot of questions. I will stay. I have a little time to stay after, so I can, for those questions we don't get answered, and if somebody wants to stay a little bit longer, but I want to be cognizant of our panelist time. So I was hoping that each of you, as we wrap up, could say maybe whether it's okay that the participants contact you after this. And then second, what's your one tip for Postbac who's thinking about going into a career in public health? So you each have about 45 seconds to answer those two questions. So I'm going to go in reverse of how we introduced ourselves, and we'll start with Kellan.
I am more than happy to be in touch with anybody. Take my advice, and it's to take me at my word, and feel free to reach out. I'm more than happy to talk with anybody about any of the questions that have come up today or other things. One thing about thinking about public health, public health, I'm just going to say it. Public health is the shit. It's a great field. It allows you to do all kinds of work. It allows you to be whatever kind of person you are. There is a role for you in public health, because you can be a program person on the front lines. You can be a policy person in government. You can be a researcher in all kinds of organizations. You can be a leader in management or wherever. So it's a fantastic field. So looking for those hacks and opportunities and ways to get into it. I'm glad you're thinking about it.
Great, thank you. Sudha?
Yes, absolutely. Please contact me and my colleagues via me. Happy to help. I think, follow your heart, is what I would say. And also don't get hung up on pedigree and institution names and, all that kind of jazzy things, because in the long run, they really don't matter. We routinely see applications at the NCI for, interns in my office, for instance, and we are not looking at if you graduated from Harvard or whatever. We're looking at what you have done and what passion you bring in to the work and how you will fit as a member of our teams. So just follow your heart. It's that's most important, because then the joy and commitment will just come through, and that'll attract people enough to you professionally.
I agree. All great advice so far. Emmanuel, you get the last word.
Well, thank you so much. So it's been a pleasure. Happy to stay after and answer some more questions. Number one, public health is a great field to be in. I would encourage everybody to be in public health. I think the COVID-19 pandemic has shown that we need more people in public health. Please pursue a career in public health, given all the issues. And unfortunately, it has shown that in the US, our public health infrastructure needs to be strengthened. So we need more enthusiastic people like yourself to really bolster, because honestly, for the next pandemic, I don't think we're going to do well if in terms of public health, if we don't have more individuals like yourself in this field. So I will make a plug for my school in terms of public health. So I'm going to be shameless. So if you're interested in terms of the programs that we have, but in not only my school, there are other so many other wonderful schools. There are Hopkins. You have two great Hopkins alumni here in terms of public health also. But please, I would implore you to really seek out public health, as Kellan and Sudha has basically articulated. You can be the person you want. It is a field for growth in terms of just different positions. And it is a very challenging field. So you will be doing something in one year or one decade, and then you'll be doing something else in another decade in terms of this field. So it's a wonderful field, and it's definitely a delight to mentor so many bright minds in terms of what I'm doing now. So
This was a great way to fabulous advice you all gave for ending this panel. I thank you all again for participating. Panelists, please do feel free to go. And, I volunteered to stay a little longer, but you do not have to, because I know you're all very busy.
I have to run, but thank you all, Jackie, Emmanuel, Sudha, Laura, and thank you to everyone who is here. I've loved your questions, and I am looking forward to being in touch.
Kellan, it's a pleasure to meet you.
Nice to meet you, Kellan.
Thank you so much, Kellan, and thanks to all our panelists.
Keep up the good work.
Jackie, I did see a couple of questions where people were asking about having an MD and kind of how clinical experience can fit into a public health career.
Do either of you have any thoughts on that?
I think a MD would be a great fit into a public health career. I've worked with people who have had MD and MPHs in terms. I know that there are people who are MDs who run public health departments. So I think that having an MD is not a barrier to public health. And I think it's a great segue into a public health career. So that is, to me, is not an issue in terms of public health. Again, it's just about getting those skill sets in terms of public health and just moving into that arena.
Yeah, and I feel like I meet a lot of folks now who are really interested in not only practicing medicine, but really thinking about how their practice of medicine can be applied in a broader public health context. And I meet folks who are going the MD, MPH route, going into a combined career, or even who have taken some time away from their MD to do some public health research. And again, this is that degree question, right? Like, do I need to get an MPH No, not necessarily. If they spend time learning, doing research in the public health space, that they can then move after their MD into a research area. There's definitely programs to do that.
Right. And you guys have the world's most famous public health person at the NIH, Dr. Anthony Fauci, of course.
Yeah. Emmanuel, I'll ask you this question. Can you teach at the college level with only an MPH?
You can teach at some colleges. I think that many individuals, like at community colleges, you definitely can teach. I think at many universities, they would prefer more of a terminal degree. But I think most community colleges, they don't mind, but most universities would prefer a terminal degree.
What about applying? Any tips either of you have on applying for, I mean, the person asked specifically about a PhD program in epidemiology who doesn't have a lot of experience, but I think that this can be the same. The same can be said for somebody who's going to potentially apply for an MPH that doesn't have a lot of already, doing a lot of experience working in a public health space. Any tips or ideas for folks?
I would say that because that's a terminal degree, typically you see folks, the accepted cohort tends to be more experienced. So it is quite rare, in my opinion, to have somebody finish a bachelor's degree, for instance, and directly be accepted into a PhD program. I'm sure there is examples, but in the public health field, I remember reviewing applications when I was at Hopkins, and really there is a lot of folks who come in with 2-3 years of experience implementing programs, being part of an evaluation team or leading, being project director of a program, whether it is directly related to service delivery or program management, or it is research. So the evidence of having done work is useful. If you're really interested in academic research, some joint publications, having some demonstration of your ability to write scientifically is also useful, I think. So as you're thinking of applying to a PhD program, try and seek experiences that may help you get published or get some more actual experience. I know I deferred my PhD for 2 years to go work in rural India because I was advised that if you don't do it now, you won't do it again, and it remains true.
I would agree. Having work experience is important. One hack could be working in that lab, right? So the individuals that usually have a stronger reception to their applications are individuals that have identified a mentor at that particular school. And the way to identify a mentor is usually to be working within that laboratory, right? And then say, I'm working in this laboratory, or have a compelling, usually statement in terms to go with your application. And to have a compelling statement usually says, I have already identified a mentor, which is this particular person. We already have put together 2 publications. And when I come, I'm going to be working on this. And by the way, the mentor is already knocking on the door of the admissions committee saying, you need to bring this person on board because I already have funding for that. That's a no-brainer for the admissions committee, because the admissions committee knows that if you admit this person, the mentor already has found funding to support their PhD, etc. So that's one hack, right? In terms, because usually for PhD students, there's a certain pool of funding and you're competing with everybody else for that pool of funding. However, if your mentor has already have funding because of an NIH grant that they can put you on, that puts you in a different category, and it makes it easier for the admissions committee to basically say yes to you. So that's one way to sort of quote unquote hack the system in terms of getting admissions to a PhD program in some ways, or even a DRPH program.
Definitely another good tip. Well, I know we're almost 10 minutes past the hour, so I think we should wrap it up. I know, Emmanuel, you have lots of other commitments left today. I'm sure everyone else does. So thank you again, everyone, for participating. Thank you especially to our panelists and for Laura for organizing and helping us keep the show going today. And it was a pleasure seeing you again, Sudha. I'm sure we'll see each other again soon, and to meet you, Emmanuel, and to work with you, Laura.
All right.
Thank you,
Bye.
Laura.
Luck,
Thank you, Jackie.
everyone.
Bye, Manuel. Good to
Well.
see you.
Bye.
Bye.
Take good care.